Procedure guidelines, PICC line dressing changes. What are the signs of immediate indications for dressing change? Dressing is not intact. Reinforced with tape. Change dressing only if. Non-occlusive dressing. Not intact dressing is reinforced with tapes. Mandatory change within 7 days if using a hemostatic product such as BioPatch. Important reminders: do not reinforce dressing with tape. Submerge dressing under water at any time. When it comes to dressing changes, the PICC team has several key responsibilities. First, confirm the timing with the infant's nurse and make sure they're present at the bedside. Always maintain the safety bubble range throughout the procedure and delay any cleaning or trash removal until it's complete. Lastly, everyone within 3 feet of the procedure area must wear a hat and mask to maintain a sterile field. Be present and available to assist with the dressing change. Gather additional supplies as needed. Hold extremity or pacifier in place to help soothe or stabilize the infant. Immediately notify the PICC team member if there is a break in sterile technique. Pre-procedure responsibilities. Assess infant stability for the procedure. Consider if sedation is necessary. Provide comfort measures, swaddling and/or oral sucrose. Notify and educate parent about the procedure. Coordinate dressing change timing with primary bedside RN. Clear the bed area of extraneous items to prevent contamination of the sterile field. Pre-procedure gather equipment including PICC line dressing kit, if available, suture removal kit, 3M Advance Affour dressing, adequate size, chloroprep or betadine alcohol, wipes, disposable mask, hat, a pair of sterile glove, a pair of disposable gloves, securement device if available, sterile field, blue drapes 2x2 gauzes, Cavalon swab. Pre-procedure, perform. Hand hygiene, put on mask and buffant cap. Open equipment on sterile field. Dressing removal steps. Remove outer layer first. If more than one layer, remove one at a time. Use saline wipe or alcohol to moisten dressing if necessary. Slowly loosen the tegaderm dressing around the edge. Stretch the edges of the tegaderm for easier removal. Remove old tegaderm dressing in the direction towards the insertion site. Stabilize catheter disc with non-dominant hand. Have assistant hold the PICC in place at insertion site using a 2x2 gauze while PICC RN performs hand hygiene. Cleansing the site. Cleaning agent and skin preparation for infants less than 26 weeks. Corrected gestational age, use betadine solution. For infants greater than 27 weeks. Corrected gestational age, use chlorhexidine, cleanse the skin around and at the insertion site, inner to outer. Disinfect by gently applying chlorhexidine alcohol solution. Tap, not rub. Allow to air dry for 1 to 3 minutes. Chlorhexidine, at least 30 seconds. Betadine, at least 60 seconds. Do not blot or blow dry. PICC external lengthen dressing application. Check the PICC external length. Compare with previous charted measurements from the PICC note before applying the transparent dressing. Ensure a slight curve in the catheter under the dressing to decrease tension. If necessary, adjust the hub of the catheter to different pressure points on the extremity. Use forceps from the suture removal kit if needed. Apply Cavalon around the insertion site and allow it to dry. Place 3M Advance 4 Tegaderm dressing over the insertion site, ensuring it covers the hub. Optionally, use a second piece of Tegaderm in a chevron technique, adhesive side up, under the extension tubing next to the hub, crossing over the hub and on top of the transparent dressing. Do not place steri strips directly over the insertion site. You may use 1 to 2 steri strips on top of the chevron cross area. Don't ever place tape, including steri strips, over the catheter as it compromises the strength and integrity of the catheter. Loop the catheter over itself, ensuring one section rests on another section of the catheter. Readjusting the catheter. For upper body insertions, the PICC tip should reside in the superior vena cava. For lower body insertions, the tip should be positioned in the inferior vena cava, preferably in the thoracic aspect. If the sterile field is maintained and the X-ray is done timely, repositioning the catheter is possible. If not, the catheter may only be withdrawn to reposition.